Hello everybody, how are you? I am Mohammed Ahmed and your teacher here, and I will be teaching you different questions and their answers. So I welcome you on classtheta.com where we will be discussing question. So let's get on the question. Our today's question is: a silent with arthritis is scheduled for a surgical knee joint replacement. The silent will be admitted to the hospital on the day of the surgical procedure, and the nurse is reinforcing instructions with the silent regarding preparation for the surgical procedure, which silent statement indicates and understanding of the preoperative instructions. Option number 1: I cannot drink or eat anything after midnight on the night before surgery. Option number 2: I need to discontinue my prescribed knee exercises at least. Option number 1: before surgery. Option number 3: I need to stop taking my prescribed prednisone 48 hours before the scheduled surgery. Option number 4: my last dose of prescribed acetylsalicylic acid should be taken the evening before surgery. The correct answer of the question, option number 1: I cannot drink or eat anything after midnight on the night before surgery. Preoperative instructions are important to so that the saline is irradiated adequately for surgery and all has been done to achieve a successful outcome. The silent must understand the importance of following at the time of being NPO to lower the risk of aspiration associated with the anesthetic. Antiplatelet medications such as aspirin alter normal clotting factors and increase the risk of hemorrhage. Aspirin has properties and that can alter the clotting mechanism and should be discontinued at last 48 hours before surgery. Prednisone or corticosteroid should not discontinued abruptly. In fact, additional dosages of the corticosteroid may be necessary before stress situations such as surgery. There is no reason to discontinue prescribed exercises, and discontinuing exercises in this silent may be harmful. Focus on the subject preparation of silent of surgery and eliminate option 2 first, because discontinuing exercises can be harmful to the silent. Knowledge regarding the medications that affect the surgical silent will assist in eliminating option 3 and 4. General principles related to preparing a silent for surgery will direct you to option 1. So that's the correct answer of the question. If you have any question, just leave a comment. I will be answering you as soon as I can. Thank you very much for watching the video. Please don't forget to like, share and subscribe our channel. Until next question, bye bye.